Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
I'm just doing well. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines and our lone U.S. COVID statistic through today, October 3rd. We invite you to submit any questions or comments down below or at any of our social media linked in the description. Starting with that abbreviated COVID statistic. In the last reported week, the US saw 26 daily COVID deaths. In the same week in 2024, we saw 177 daily COVID deaths. Your reactions to those numbers and the state of COVID in the US, Dr. Murphy?
Yeah, pretty much the same. The big thing here is the difference between 2024 and 2025. So, there's a sevenfold decrease in the amount of deaths per day. So this is really great news. And it's because of the immunity in the population from prior infection and vaccines. Right now, it looks like we're at the end of the summer wave. So this summer wave looked like it had two little humps, but of course much smaller than last year. Emergency department and hospitalizations are slightly elevated, and the overall peak was down. And then the surveillance, where they look in wastewater for the virus, has dropped down to moderate levels. It had been very high, and then now it's down at the moderate level. And the emergency room test positivity rate, people coming in with symptoms of COVID, dropped from 7.8%, declined to 7.8%. Most of the highest levels were in kids under 4 years of age. So that's basically what's going on with COVID. Respiratory syncytial virus, another one of the respiratory infections that can affect people and make some people very ill and even cause death. That wave hasn't really started yet. So plenty of time to get the vaccine for that. And the flu rate, very low, but flu doesn't really take off till December. And then January and February and beginning of March are the big flu months. So the other news is that in the Southern Hemisphere, they have the opposite time of their flu outbreaks. They've identified which flu strains are likely to hit us next year. So they're already working on developing the vaccine for 2026. But the one that's available now is obviously for 2025. And that's all ready to go.
Mhm. Now, there was a COVID study published just earlier this week that had some very great takeaways, but was a little bit confusing to get into. It's about the loss of smell and that lingering effect after COVID. Can you bring us the key takeaways?
Yeah, so this is a very interesting study looking at loss of smell. It was a study of 3,525 people, which included COVID survivors who reported smell loss, and some who didn't report smell loss, and then some who were never infected. So three different groups of people. So what really happened? The results are just, it's a very dense kind of report, but the bottom line was that it looks like the smell, people who lose the ability to smell everything, and they do this by testing 40 different odors. And they did this at 83 sites in the US and its territories. So they test you for the 40 different things. So the loss of smell can go on for years after infection. And it turns out a lot of people didn't know that they actually had a loss in smell. So those are the two important findings. And there didn't seem to be giant differences in between infected and uninfected participants without reported loss of smell. But they did find a lot of people had deficiencies, and they highlight a couple of the smells. I thought you just might find it interesting. Cloves, grass, licorice, and watermelon turned out to be the ones where there was a lot of loss of that type of smell if you have a loss. So people can have a loss, they don't even realize it. And people that have it, this can last for years. So that it was a very fascinating study from the University of Pennsylvania.
Very, very interesting. And switching gears a little bit into RSV, which you did mention, we have more study data on the efficacy first of the monoclonal antibody for infants. Can you share that with us?
Yeah, this has really been a game changer. So it's not a vaccine, it's an antibody therapy, and you give it to kids under a year old or under 2 if they're immunocompromised. And you give it just before the RSV season, which is coming up this winter. This drug was first recommended only in 2023, and it's just had a remarkable effect, positive effect, great effect. So they collected electronic medical records from 1,700 hospitals and 40,000 clinics in the United States, Canada, Lebanon, and Saudi Arabia. And so they ended up looking at over 400,000 infants in the final analysis, of which 3,300 had a hospitalization for respiratory syncytial virus. So it's a huge analysis. And what did it show? In this gigantic analysis, it showed that that hospitalization rate was 77% less in children. So if you look back before this drug came out, pediatric hospital beds in the winter were loaded with kids with RSV. And it's just had this remarkable impact on the hospitalization. And remember also that infants can be protected not only from the monoclonal antibody, but if the mother gets the RSV vaccine in her 3rd trimester, the mother will make the antibody and pass it to the baby, and those babies are protected as well. So this has saved so many children from hospitalization and death. And it's really just nothing short of incredible.
It is, and that's a great segue into our next topic, which is a Cochrane review of the RSV vaccine for older people and infants and pregnant mothers. Can you tell us about that?
Yeah, well, there's a lot of things going on with the RSV vaccine, and it's recommendation from CDC and everything. It's changing a little bit. So anyhow, this Cochrane review it's a type of analysis that's scientifically very valid. I mean, pretty much every epidemiologist in the world realizes that this is a great way to look at multiple studies looking at the same disease. So they looked at 14 clinical trials that had enrolled over 100,000 people. And they found that these vaccines were safe, and they showed that there was, again, 77% effective against RSV-associated pneumonia and 67% effective in protecting against acute respiratory disease. That's just the common cold in older adults. And again, the study in the pregnant women, as I already mentioned, showed that they reduced the impact on those children as well as the mother who took the vaccine. So again, lots of patients, over 100,000, and it's safe and remarkably effective. We don't know how often or when you have to take a booster. Right now, you just take 1 dose of the vaccine. I've taken it myself, very well tolerated. And we know that the antibody levels do come down a little bit in the 2nd year, but there's no firm recommendation for a booster shot yet. But keep your eye on the news, because that could change.
Something that we will continue following and talk about as soon as we can. But we do have an update on our US measles outbreaks as there are more cases. Can you bring us up to speed?
Yeah, so there's still more measles, 30 more cases over the past week. Mostly over 92% were unvaccinated or of unknown vaccination status. So far this year, 2025, we've had 42 outbreaks. This is compared to 16 outbreaks last year. And new cases have popped up in Minnesota, California, South Carolina, and New York. Or New York is just they're finding it in the wastewater, but not in patients. But that just means in the wastewater somebody has it somewhere. So it's unlikely to these epidemics of measles, as long as people are unvaccinated, it's going to continue.
Mhm. Now, just as we saw the COVID numbers going down and that death count earlier, a great result from herd immunity and people being vaccinated against COVID. If we look to a different vaccine, this time HPV, we can see how effective that shot is and some great herd immunity effects as well. Can you break down the data for us?
Yeah, so HPV has been out for a while, and this analysis looked over the 17-year period that the vaccine's been available. And they found that the vaccination rate went from 0 in 2006 to 82.1% in 2023. And what they showed was really very interesting. Of course, the women who, at risk for cervical cancer from HPV virus, HPV, human papillomavirus, had markedly less HPV. And so they had less cervical cancer and less cervical disease. What they found, though, which was of interest, is that even the unvaccinated women had a decrease. So, matter of fact, Dr. Jessica Kahn, one of the study authors, stated, quote, "We actually purposefully sampled women who had relatively high risk for HPV infection and therefore for cervical cancer because they're typically not well represented in clinical trials." And I was surprised to find that our findings were very similar to findings in more representative populations. So even in the high risk groups, everybody seemed to go down. So why is that? Well, there's less HPV in the population because you have up to 80% of the at-risk people vaccinated. And so it's the herd immunity is protecting, it protects everybody. It protects, of course, the ones that took the vaccine better, but even in the unvaccinated ones, their rate is much lower than expected. So that's good news as long as we keep the vaccination rate up in the 80%. And who knows if that's going to happen, because we'll have to see what the final recommendations of the ACIP group and whatever. I know there's some talk about, some people, there's such anti-vaccine sentiment out there, but we can basically prevent cervical cancer in the United States and everybody if we get enough people vaccinated.
Yes, very, very promising results and exciting to see. Our final story for today shows more evidence of how impactful vaccines can be. GAVI, the Global Vaccine Alliance, released their latest progress report on the work they did in 2024. Can you tell us about their impact?
Yeah, so GAVI, which has gotten defunded by the United States, of course, but there's other donors that are keeping it afloat. They have calculated that their vaccine project, and they supply multiple types of vaccines, that they think they've saved 1.7 million lives, which is, this is in 2024, that was 400,000 more than in 2023. And you can do sophisticated analysis. Well, how does that affect an economy? Because you have to pay for those vaccines and you have to pay to deliver those vaccines. Well, keeping people healthy is generally a good thing for business. And sure enough, they've calculated that they've saved at least $20 billion economically by having this healthier population. Since the group GAVI was established in the year 2000, if you put all the years together, that number jumps up to $280 billion. So being healthy really, really pays off. One of the big things that happened in 2024 was the vaccine rollout for malaria. So the malaria vaccines, they don't work as great as like with other diseases, but they do work. And the ones who are at most risk from dying from malaria are under 5 years of age. So it had an enormous impact on protecting millions of children in Africa, which represents 70% of the whole disease burden for malaria. So it again was just way more successful, well, more successful than it originally thought. And everybody's, very happy to see this kind of report come out.
Very excellent to see such an impact from Gavi and the excellent work that they do. But on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise breaking down all of the latest status for us. It's much appreciated.
Well, thank you, Katie, and have a great weekend. It's going to be a beautiful
Thank
weekend
you.
here in Chicago. Indian
Very
summer.
beautiful here in Chicago. Love that Midwest weather, the Midwest fall. And thank you all for joining us for this week's episode of Ask Dr. Murphy. Hope to see you back next week. And of course, if you have any questions or comments, please leave them down below or at any of our social media. Have a great weekend.